In Module 1, Lecture 3, we're going to continue going through the anatomy of the cardiovascular system. Our module learning objectives, again, are MLOs. Describe the location and function of the atrioventricular valves. 12. Describe the location and function of the semi-lunar valves. 13. Describe the purpose and function of the coronary arteries. 14. Identify the branches of the left main coronary artery and the area of the heart that each branch supplies. 15. Identify the area of the heart that the right main coronary artery supplies. 16. Identify which vessels make up the system's circulation of the human body. 17. Identify the vessels that make up the pulmonary circulation of the human body. And 18. Trace the blood flow through the heart, starting at the right side of the heart and ending at the left side of the heart. So picking up with the valves. So we discussed in the last lecture that the heart has 4 chambers: the right and left atria and the right and left ventricle. So if you know medical terminology, or even you can just use context clues, atrioventricular valves are going to be the valves that are in between the right and left atria. On the right side, you've got a tricuspid valve. The atrioventricular valve between the right atria and the right ventricle is the tricuspid valve. It actually has 3 flaps or 3 cusps that actually open and close. These cusps are attached to papillary muscle by heartstrings or the chordae tendineae. This prevents regurgitation from the right ventricle back into the right atria. On the left side of the heart, you have the mitral valve, also known as the bicuspid valve. So if a tricuspid valve has 3 flaps, a bicuspid valve has 2 flaps. You've got the anterior and posterior leaflets of the mitral valve. You probably have heard of the mitral valve in a condition called mitral valve prolapse. And again, these valves are attached to papillary muscle by the chordae tendineae. So one way that I try to remember which is on the right and which is on the left, the tricuspid valve, I try to do right. So try and right are in the same. Or I try before I buy. So I try tricuspid before I buy bicuspid. With the mitral valve, one way that I remember it is that the mitral valve actually has an L in it on the left side of the word, mitral, L. So then you have the semi-lunar valves. So the heart has 4 valves. You've got 2 atrioventricular and 2 semi-lunar valves. So semi-lunar valves are going to be between the right ventricle and the pulmonary artery and the left ventricle and the aorta. To remember these, just think of the name. The pulmonary semi-lunar valve is between the right ventricle and the pulmonary trunk. So essentially what happens with the pulmonary semi-lunar valve is that it connects the pulmonary artery. So this is your pulmonary semi-lunar valve. So it connects the pulmonary artery with the right ventricle. So it actually opens and closes to allow blood to go through and then to keep blood from regurgitating back. The aortic semi-lunar valve is on the left side and it's between the left ventricle. So here is your aortic semi-lunar valve. So it's between the left ventricle and the aorta. It keeps blood from coming back into the left ventricle, and the left ventricle pumps blood out into the aorta by the aortic valve, the aortic semi-lunar valve. We discussed in the last slide the tricuspid valves, and here's just another cutaway view here. So on the left side, here is your bicuspid. So you've got 2 cusps here, so there and there. And then here you've got your tricuspid, and you've got 3 cusps. So you've got this one, and this one. All right. And so if you look at your semi-lunar valves, they're made up of essentially the same thing. And they sort of look like a half moon. So that's where semi-lunar comes from. So here's a little mnemonic to help you remember the blood flow through the cardiac valves. Tissue, paper, my assets. So tissue is tricuspid, paper is pulmonic, my is mitral, and assets is aortic. So moving on into coronary circulation. So coronary circulation is essential for the heart to have a reliable blood supply. So I'll mention this again, but you can go ahead and put this in your pocket so that you can pull it out later. The heart receives its blood from the coronary arteries during diastole. The rest of the body receives this blood during systole. Oxygenated blood reaches the heart through the coronary arteries. There's two main coronary arteries. You've got your left main and you've got your right main. The left coronary artery, which is going to be your shortest coronary artery, but your largest in diameter coronary artery, divides into the left anterior descending artery and the circumflex artery, both of which branch widely to supply the left ventricle and the interventricular septum and part of the right ventricle. The right coronary artery travels between the right atrium and the right ventricle by way of the atrioventricular groove. Branches of the right coronary artery supply blood to the walls of the right atrium and ventricle, a portion of the inferior part of the left ventricle, and portions of the conduction system. So, not everybody's anatomy is the same, but in patients that are considered right coronary dominant, the left inferior wall or the inferior wall of the left ventricle is supplied by the right coronary artery. There's also numerous connections, also known as anastomoses, between the arterioles of the various coronary arteries, which allow for the development of alternative routes of blood flow. This is going to be important to form collateral circulation, which collateral circulation is a formation of additional blood vessels connecting arterioles originating from other blood vessels. The arteries and the main coronary vein cross the heart in a groove, which is called the coronary sulcus. This separates the atria from the ventricles. Venous blood empties into the coronary sinus, which is a large vessel in the posterior part of the coronary sulcus, which in turn then dumps blood into the right atrium of the heart. So we just talked about it. The LCA, it supplies the left ventricle, the interventricular septum, and some of the right ventricle. You may hear the LCA known as the widowmaker if you have a high occlusion, because it supplies around 85% of the blood to the myocardium. So if you have a blockage in the LCA, the chances of you doing well really are not very good. So with the left coronary artery, which is here in red, it comes here and then it circles around. The circumflex artery actually circles around and hits the high lateral wall of the left ventricle. It also, the left coronary artery turns into the left anterior descending, which supplies some of the interventricular septum, the anterior wall, and the septal wall of the left ventricle as well. Sometimes the circumflex artery can actually come around and supply the inferior portion of the left ventricle. But again, going back to what I mentioned earlier, the right coronary artery will often supply portions of the left inferior wall as well. Here's just another view of what we just discussed. So peripheral circulation or systemic circulation. Arteries carry oxygenated blood away from the heart. They are sensitive to autonomic nervous system stimulation, which would cause them to expand or contract. Blood pressure is generated by repeated forceful left ventricle contraction. Veins carry deoxygenated blood back to the heart, and capillaries separate the arteries and the veins. So you also need to discuss vessel walls, because this is going to be important in a few weeks when we start talking about aneurysms. So the vessel walls, they're composed of several layers. You've got the tunica intima, the tunica media, and the tunica adventitia, and then the lumen, which is the whole of the vessel. So one thing to remember, the larger the diameter, the greater the blood flow. And so our vessels are designed to expand and contract. The tunica intima is going to be the innermost layer of the vessel wall, and then you've got the tunica media, which is the middle portion, and then the tunica adventitia, which is the outer portion of the vessel wall. So to sum this up, the systemic circulation is comprised of all blood vessels between the left ventricle and the right atrium. And the pulmonary circulation is all blood vessels between the right ventricle and the left atrium. So, it's going to be important that you're able to trace a drop of blood through the heart, or essentially know how the blood flows to the heart. So, I'm going to discuss it right here. You've got blood that returns from the superior vena cava and the inferior vena cava into the right atria. The right atria then contracts and pushes blood through the tricuspid valve. The tricuspid valve will then close and blood will be in the left ventricle, or the right ventricle. The right ventricle will then push blood into the pulmonary artery by way of the pulmonic valve. The pulmonary artery will deliver blood, deoxygenated blood, to the alveolar capillary walls or beds of the lungs, where oxygen transfer will occur. So oxygen will be brought on and CO2 and other waste products will be brought off. So once that oxygenated blood has reached its capacity, it will return to the left atria by way of the pulmonary veins. It will then drain into the left ventricle, but it goes through the bicuspid or the mitral valve first. The left ventricle will squeeze and push blood through the aortic valve into the aorta, where blood is then delivered to the rest of the body. So here's just a little video of what happens. So you can follow a drop of blood. You got right atrium, tricuspid valve, right ventricle, pulmonic valve, pulmonary arteries. Then you've got the left atrium, the mitral valve, the left ventricle, then the aorta. So the total blood volume is distributed like this between the systemic circulation and the pulmonary circulation. So about 85% of the systemic circulation, or about 85% of the blood, will be in the systemic circulation. About 10% of the blood will be in the pulmonary circulation, and then about 5% will be in the heart chambers at any given time. So again, blood enters the right atrium via the superior and inferior vena cava and the coronary sinus, the venous drain for the coronary circulation. About 70% to 80% of this blood flows passively from the right atrium through the tricuspid valve and into the right ventricle. The remaining 20% to 30% is forced into the right ventricle during atrial contraction, also known as the atrial kick, which we'll discuss in future lectures. The right ventricle expels the blood through the pulmonic valve into the pulmonary trunk. Pulmonary trunk divides into a right and left pulmonary artery, each of which carries blood to one lung. Blood flows through the pulmonary arteries to the lungs. Blood that is low in oxygen passes through the pulmonary capillaries, Blood comes into direct contact with the alveolar capillary membrane, where oxygen and carbon dioxide are exchanged. Blood then flows into the pulmonary veins. The left atrium receives oxygenated blood from the lungs by the 4 pulmonary veins, 2 from the right lung and 2 from the left lung. Again, about 70 to 80% of the blood moves passively from the left atrium into the left ventricle through the mitral valve. The remaining 20% to 30% of the blood is forced into the ventricle through the atrial kick. With contraction of the left ventricle, blood is ejected through the aortic valve to the aorta, and the blood is distributed to the body, or the systemic circulation. And this concludes Lecture 3. Let me know if you have any questions. Thank you.